You are listening to TechVibe Radio. It's coming at you from the Huntington Bank studios. TechVibe Radio is your front row seat to Pittsburgh's fast-moving technology ecosystem. TechVibe is brought to you by the generous support of Blink at 321blink.com, Chorus Call at choruscall.com, C-Leveled at c-leveled.com, Compunetics at compunetics.com, Huntington Bank at huntington.com, My Benefit Advisor at ptc.mybenefitadvisor.com, and PNC Bank at pnc.com. Here are your hosts, the Pittsburgh Technology Council's Audrey Russo and Jonathan Kirsting. Good morning, everybody. I hope your Sunday is off to an awesome start. So glad you're listening to TechVibe Radio this Sunday morning. It's great to have you with us. That is for sure. You know, we get to hang out with some of the coolest people here on TechVibe Radio. My co-host and boss, Audrey Russo, and I, we get to do some really fun podcast series with a number of companies, and one of my favorite is hanging out with Highmark. We do Healthcare Reinvented to explore the intersections of technology and healthcare, and our latest episode details alcohol use disorder. If you didn't know, according to the Substance Abuse and Mental Health Services Administration, 14.1 million adults ages 18 and older had alcohol use disorder in 2019. That's a lot of people. That's creating lots of hardships for people's lives. It's impacting quality of life. It's also impacting the cost of healthcare. So in our next episode, we talk to Demetrios Marousis, who's Director of Behavioral Health at Highmark for this podcast. Really knows his stuff. He has some very enlightening information around alcohol use disorder. And there's even a technology solution to help people manage it as well too, which I think is very exciting. Once again, showing that intersection between tech and healthcare. So you got to listen to this. You're going to learn a lot. And if you want to listen to the entire podcast, just go to pghtech.org. And under our podcast dropdown is Healthcare Reinvented. You can find this podcast along with dozens of others detailing very important subject matter, as I said, right at that intersection of healthcare and technology. And Demetrios, we're really excited to talk to you today because there is a lot to cover, especially with the pandemic impacting people's alcohol consumption.
Yeah, really good point. Really good point. I didn't even think about that. So thank you for being with us today. This is wonderful. So
well, I'm glad to be here. Thank you.
No, let's see how we set the stage, right? How do we set the stage for what is just a comprehensive and complex discussion? Should we start with what is alcohol use disorder and how is that different than being an alcoholic?
Well, alcohol use disorder, I mean, is really this, in the most sort of simplistic terms, this use of alcohol where it's interrupting your day-to-day functioning, where the consumption of alcohol, the thinking about your next drink, you're planning your next drink, is at the forefront of your life.
Right.
Wow. So, when we're talking about alcohol use disorder, we're talking about sort of on a continuum, that sort of far end. In reality, we could talk about an individual's relationship with alcohol, because there are, individuals who can have a relationship with alcohol and there's no dysfunction at all. And there are others where it's episodically dysfunctional, so somebody who's a binge drinker, 4th of July, they let go. They plan it out. Right. They're completely out of commission. There's others who are systemic and very planful about their drinking. And, old school language would have called them sort of functional. They're still able to sort of show
That's
up.
Old school functional alcoholic.
Yeah, I mean, they're still able to show up for all of the sort of society's expectations in many ways. And they, are able to sort of, still drink. Now that ultimately catches up because, certainly there are health implications of consuming a substance like alcohol over a long period of time.
Definitely.
And so it sort of can tend to, certainly make you less healthy down the road or exacerbate other conditions.
I know, right? Like, and so, how does that get diagnosed, or how does it appear? Like, how does it manifest?
Well, I mean, so that, I think that's the other that's the other tricky piece. So if we're talking about alcohol use disorder, I would talk about sort of where it's clearly diagnosed. So a professional has, weighed in, and for the most part, that's likely to be a primary care physician who would have sort of, first contact and have that first opportunity. And through sort of screening sort of tools that are available to them, have an indication that, more might need to be done. And that more might be a brief intervention, a referral, or, to other treatment that needs to be a little more intensive.
Does it also sometimes come from like an intervention from something terrible happens, like a DUI, or like someone's had too much and they hurt themselves or somebody else?
It certainly can be. Yeah, it certainly can be. And so once again, that's the other place it can sort of show up, and whether it's diagnosed as an alcohol use disorder or it's an alcohol related. So let's talk about an emergency department, sort of, somebody shows up at the emergency department with a leg injury, and, sort of, gardening with power tools enhanced by, alcohol.
Ooh, I never thought about that. That's a terrible way to figure this out.
So once again, so they show up, and they have something that's necessary, it's treated, but you once again have that sort of alcohol kind of component to it. May not rise to a formal diagnosis of alcohol use disorder, but it's an alcohol related impact to healthcare spend.
That's so
and
true,
resource consumption.
Do we know? Do we have any data on alcohol use disorder and the correlation between those kinds of incidents? Because that's sort of opening my eyes a little bit.
Well, I mean, we're working on that. So one of the interesting thing is there's ways of sorting, emergency department visits. So there are those emergency department visits that are absolutely necessary and completely unavoidable. And we can look at, but we're somewhat dependent on the, what diagnoses and how it's coded, how that visit is coded and how that claim is submitted. If it's done in, as we would expect, we would see some of those alcohol related pieces. And then there's parts of an emergency department visit that would have been absolutely avoidable, that they could have been treated in the primary care office. So we're looking at those components and then looking at that sort of interrelationship. Is there an alcohol related theme? Or if it wasn't coded as such by the emergency department in terms of claim submission, do we know this about a person's history? So there's some attribution there based on other things that we know about individuals. And so we're trying, from a data standpoint, getting a broader view. And what that then does is gives us the opportunity then to say, where are levers to approach this? And approaching it with sensitivity.
Of course,
because there's also very significant stigma related to having a problem with alcohol.
That's a really good point, that the stigma, and that keeps people from actually maybe seeking help because they don't want to have that stigma. And so they'll just keep saying it's fine or whatever it is. And then once again, creating potential future problems for not just themselves, but others. I mean, I just think about someone, if you're driving impaired and you hit somebody, I mean, like there's someone who's totally innocent that was, taken out because you have a drinking problem.
Sure. And sometimes for some people, those are the events. So, early in their use history, they may have a significant event like that. Whether it's, they socially acted out at a wedding after they had too much, or whether they had a driving while intoxicated kind of, event. Sometimes that is that sort of that point where an intervention, where a transition to treatment or a transition to this isn't for me, and some folks can stop, and do it safely. and never touch it again. They had their sort of wake up moment,
Yeah.
their wake up call, and they're able to sort of adjust their relationship with alcohol accordingly.
So Demetrios, I'm curious. I mean, with the whole pandemic, I mean, I keep hearing everywhere that, people to deal with the stress because they weren't able to get out started turning to maybe drinking more. Is that something that you've seen?
Well, you know what, we tracked a lot of things. And so when the
Right.
pandemic first emerged, our initial concern was alcohol in particular.
Yeah.
Because if you're, in that sort of alcohol use disorder kind of space, alcohol can be physiologically dangerous to withdraw from.
Mhm.
And so as we were watching the pandemic, emerge, we had some initial concerns as state stores and access to
Right.
alcohol was also, harder. We saw, and so once again, this is trailing data, and now it's now available to us. We saw spikes in sales, and we've seen
Mhm.
those sort of sales data increase. And we were preparing for, individuals, that might need some withdrawal from alcohol kind of assistance and
Wow.
medical
Right. Yeah.
attention. Withdrawal from alcohol for some individuals can have a high mortality. It can lead to death. And so, there requires a lot of medical management to safely, manage that withdrawal.
So the pandemic, though, do you think that you've seen more in the emergency room?
Well, once again, so emergency rooms were not, as accessible.
Right.
And so not only did you sort of see more stress and, the likelihood of more consumption because we saw sales increase. Now we can look at some of that data from,
Mhm.
from 2020 and on, but we also saw emergency departments have this, everything was locked down. And so it was harder, only an emergency coming in. And so folks, I think, had, an easier time of either not getting treated, not presenting, and sort of under cover of the pandemic and that sort of, that separateness that the pandemic sort of recommended, provoked, supported, and allowed folks to sustain, their use and with greater privacy, greater sort of, less likelihood of being discovered.
What are the effects? Like we know, like I know at the macro level,
Yeah.
if you're considered someone who's alcoholic, there's a whole bunch of effects. But what about this AUD? This by the way, that's the first initials of my name. So yeah, it's alcohol use disorder. I run an organization, right? So I feel like as an employer, I need to sort of understand some of this. Party drinking, socializing, events and things like that are really a part of a lot of the work that we do at the Tech Council. So I have actually made a practice, a rule that if you're on work time, you can't drink. Like even if we socialize and we have drinks, very, focused on that. But what are some of the near and, and long-term effects? Are they the same as with, being what might call an alcoholic?
Well, once again, so you've got that sort of immediate impairment. So, and that impairment is in, sort of judgment. The impairment can be in sort of mobility and, ability to operate equipment, machinery, all of that. So on the work site, if somebody is presenting with that degree of impairment, you can sort of imagine those opportunities. And if you have individuals that are in high risk occupations, if I'm talking to a client who has employees operating large mining equipment, for instance, that risk is incredibly significant when you're operating a truck the size of a house.
Absolutely.
In terms of impairment, if you're working remotely, it's harder to notice.
Right.
The risk is not there. The risk is sort of probably more so in terms of sort of reputation, quality of work, timeliness of work, completeness of work, being on time, and the fact that we're working remotely, you're missing all the other multisensory sort of signs, smelling alcohol on someone's breath, that kind of stuff. So we're missing some of that, but I think that's where it's showing up, and it's showing up in that sort of quality of work, completeness of work, timeliness of work, the idea of presenteeism. When I'm at work, am I fully at work?
Absolutely.
And we're also not just talking about the person who's impaired. If I'm at work and I have a family member who has a relationship with alcohol that's problematic, my mind might frequently be on, what are they doing now? How are they getting on? Did they
Never
wake
thought
up?
about
Did
that. I
they
mean,
get
that's
to
a
work
really
on
good
time?
point. If you have somebody at home that's suffering or has this, and then it's going to be distracting to you, which is then going to impact your work and your effectiveness. It just seems like this is just so pervasive. I mean, and to know that there's resources out there, I think it's just so important for us to get out there. Like, I'm just curious to learn about, like, what are some of the treatments and interventions that are available, especially with Highmark, that can be helpful in this matter?
Well, so with Highmark, we've always had a network of providers,
right,
that were equipped to, address the needs of people with alcohol use disorder, and that included withdrawal management. Helping somebody safely medically, stop use.
Basically, it's like detoxing from alcohol at that point to a certain degree, right?
Detox is sort of the older language.
Okay.
Withdrawal.
So I'm going old school with my detox language.
No,
okay.
Detox is still used. We have detox facilities. And within those, there's the medical management for the withdrawal of alcohol, and then from there you move into an active treatment mode. And within that active treatment, there's this objective of moving to a mode of recovery. And that recovery is very individualized.
Okay.
And that recovery is, what is my relationship with alcohol? What is my relationship with alcohol and the people, places, and things that are connected? So there's some folks that, if you light a cigarette, it's always connected to, I've got a drink in front of me. And, or I only smoke when I drink, or, if I smell certain things, like the smell of, of a bar. So that's sort of that relationship piece that somebody would sort of work out in their recovery plan on where they go, how they go there, when they go there, how long they stay, and who they're around, and that's not necessarily influences as much as there's there are triggers. And so an individual needs to sort of go to school on themselves, their use history, and as a result of that, construct a recovery plan. And within that recovery plan, what to do when, the if-thens. And part of that if-then is, if I've, started to use again, what's my next step? Because we are talking about a chronic, condition. And with that chronic condition, there's upsides, downsides, and individuals are not sort of immune to not having sort of a day that's less than desirable. And, what do you do then?
Really amazed at how complex this is, and to know that there's treatments out there. One of them it's called Ria, I think is something that.
Yeah, Ria is one of our newer providers that we've added to our network. And like I said, our existing network had always been prepared to treat alcohol use disorder. And what was interesting about sort of Ria in particular is that they approached it from a non-judgmental, alcohol reduction approach. And they did it in a way that, met some of those sort of stigma drivers. So you can have a relationship with Ria as your provider and not have to drive somewhere for an appointment, not have to sort of show up and be in a waiting room somewhere.
Yeah.
And for some individuals, their privacy and the stigma related to alcohol treatment is significant.
Being able to go on your laptop or your smartphone, I guess, and then have the sessions.
And
one
I
less
think
barrier to entry, I guess, as far as that goes. That's for sure.
Right. And a lot of the treatments also require a commitment. So I'm going to go live somewhere else for a period of time. I'm going to go to a residential program. I'm going to go to an inpatient withdrawal management program.
I hope you learned as much as I did from that interview. I think it's very fascinating. I'm just stoked to know that there's a technology solution that plays a part in helping people manage their alcohol use disorder. Love having these conversations. And like I said before, if you want to listen to the entire podcast, just go to pghtech.org. Under the podcast dropdown is Healthcare Reinvented. We have so many great conversations around topics just like these. I hope you check it out, dive in, and learn something, that's for sure. Once again, thanks for spending your time with me this Sunday morning. It is a privilege and an honor. Have yourself an awesome rest of your Sunday, and go to pghtech.org to learn more about the Tech Council while you're at it. This has been Jonathan Kirsting.
For more than a decade, Blink has been producing unique creative services and solutions that tell a story, move hearts, and drive decision-making that advances business objectives, your business objectives. We adopt a company-wide policy of candor, transparency, and a good old-fashioned work ethic in the pursuit of building long-lasting relationships with our clients and our partners. From video and design to strategy and digital marketing, Blink is here to creatively advance your business. Visit us at 321blink.com.
TechVibe Radio is coming at you from the Huntington Bank Studios and is made possible by the generous support of our sponsors, Blink, Chorus Call, C-Leveled, Compunetics, Huntington Bank, My Benefit Advisor, and PNC Bank.